Ladies and gentlemen, welcome to this eye-opening interview with Dr. Pete Chambers, a Green Beret and flight surgeon who's here to share some alarming evidence with us. Dr. Chambers is going to shed some light on a topic that's been at the forefront of many people's minds in recent time, the weaponization of public health. With a distinguished career in the military, Dr. Chambers has a wealth of experience in dealing with the intersection of health and national security. He's been a part of numerous operations and has seen firsthand how world governments are using organizations like the World Health Organization and the Department of Defense to further their own agenda. Dr. Chambers, thank you for being with us.
Clover, it's an honor to be here, and I'm glad we finally got to connect.
Tell us more about the weaponization of public health.
So this is something that Todd Callender, my attorney, put me on. He couldn't make it to a speech that I was doing in Alaska, and I was able to brief some Alaska legislators. However, I had to get smart on it really quick. I had about a 2-day lead time on it. I had complained to him about this in the past, just seeing the way things took off from the political level and then reached my level at the tactical on the ground. And so I was marrying that up and making connections, but I didn't really understand it until I researched it. And then it just kind of just made sense. And then I understood why when people ask me, well, how is this happening? What's going on? I got it. I haven't figured out everything, but I got a lot of it.
Yeah. So what do you mean about weaponizing public health? Let's define that.
Sure, absolutely. So our Department of Defense, by the way our Constitution in this republic was written, is the Department of Defense is to be managed by civilian entities. They're not supposed to be the Department of Defense take the lead on anything other than what the commander's intent is. That would be the President of the United States under a time of war or a time of duress, or in a National Guard that would be under the governor, same thing, emergency declaration. So when you see the Department of Defense take the lead on something, be it a pandemic in this case of what we were talking about over the past few years, that's a concern to me because things can be abused, things can be taken too far, money can be lost, policies can be placed into the shadows where you don't typically see them. And that's a weaponization in my book.
Many people would argue that the World Health Organization and other similar organizations are established to help protect us. What's your response to people who would argue against that?
Well, I would say that, the numbers of people are diminishing in that as we are waking up, not to what the mainstream media says, but to places like yourself, there less and less of that. But the World Health Organization on its face, by the name, the very name, and by some of the good things they have done in the past, has been usurped by a different group that are controlled. Ultimately, it's about finance, by money. And this is how I'll back that up. When the number 2 contributor to the World Health Organization is not an entity that is a government, which I believe now it's China, number 1, but the number 2 is a private entity, Bill Gates Foundation. So when they're the number 2 contributor to the World Health Organization, that then gives a lot of power to a man who is not a government, who is not voted by us to lead us. Lots of room there for some mistakes as well.
What evidence do we have to support this?
Well, I just follow the money. When I'm going after a target, I was a Green Beret before I am what I am now. I'm out of the military, but it's also a flight surgeon. But when we targeted something, 90% of the time we could follow the money. And when you follow the money, the evidence is there. And I'll be giving some specific codifications of laws and treaties and exords that will help to help shape that. You can look it up, and the proof will be there.
We just came across the article that came out by the Epic Times today. I think it was originally posted by Joseph Mercola, who they're addressing how the federal government is tracking the unvaccinated and the partially unvaccinated with these ICD-10 codes that were established in 2012 by the WHO. And that's the International Classification of Disease. And our understanding is that if you are a doctor that takes insurance, you have to report these ICD codes to the government as part of the medical electronic health record that is. And all of a sudden, when we go to the doctor, we're getting some really strange questions. Even here in Texas, when our children visited the doctor, they were asked, "Do you have firearms at home?"
Right.
And now we're assumed to be asked our vaccination status. Can you speak to that?
Sure. Yeah. So that is a collection of information, and some would call that intelligence gathering. What I do the same thing when I go downrange and I'm talking to a village of people that potentially could have Taliban in their midst. I collect intelligence by talking to patients. I mean, they'll tell you things, but in that case, it's not a federalized thing. So this would be almost a federalization as well of public health at that level, because it becomes a bureaucracy, and then your doctor typically then is focused on the checking the blocks, and they get dinged on those things. It's hard to be a family doc anymore, or a private physician anymore, because you get dinged on those and you lose remuneration back to collect those monies that were out there by Medicare and Medicaid. And the insurance companies are following suit as well, because as Medicare goes, there's a saying, so do the insurance companies.
And we also read in the article that said, if you don't take the vaccine, your doctor can bill your insurance company for something called immunization safety counseling.
Right. And so yeah, and I don't know about that specifically. I heard it was coming, but when I see things like that, that tells me that the people that are pushing the vaccines are desperate. They're desperate to try to get 100% vaccination. That's a control thing. Vaccinations are not policy. Vaccinations in the past have been based upon need, and it's risk versus benefit. There's always a side effect to anything, And so there's always a risk and benefit, and you do informed consents. What I got fired from the border, Texas-Mexico border, from doing was informed consents. You have to tell people the good, the bad, and the ugly, and say, and based upon these things that you have and your age, et cetera, you do not need or you need, but it's still your choice.
Yeah, unwrap that a little bit. I'm sure some of our viewers are not familiar with your story about what you were doing on the border and what happened. Can you give us the
sure,
helicopter view of that?
Yeah, sure. Real quick, I served from 83 till 2015. I left active duty from Fort Bragg, came back to Texas, went to the Texas National Guard, and left in May of last year. But my last job was on the border, the Operation Lone Star, where I was the task force surgeon. Best job I ever had. Best job I had by all those years in the military, because I was actually felt like I was helping protect America's border, Texas's border. Satisfaction wise, numero uno. However, it also coincided with the time when the vaccines were mandated by the military, by Lloyd Austin and the Secretary of Defense, to include the Guard units. And so we had to either take it or they had to get out, but they were not allowing religious waivers nor medical waivers. And typically all my years since 2003 as a doctor, I could do a medical waiver if somebody had an allergy to something in one of the mixes in some of the ingredients, or if they've had a vaccine similar and they had a reaction, or if they have something that precludes them, which 90% of the people on the border, which precluded them, was their age. They had a 99.9997% chance of doing just fine without a vaccine. Why roll the dice? And now that we see that the injuries coming out, we were 100% spot on. I gave informed consents. Soldiers didn't take it. Command didn't like it. I was fired.
Many people are skeptical about claims suggesting that the government agencies or international agencies are involved in nefarious activities. What would you say to someone who is just waking up to this?
I would say measure twice and cut once. I can't answer for all agencies, and I don't think there's any blanket statement that says that they're all nefarious. I think there are nefarious people that work within, because anything having to do with money at the higher levels where you can make money when you're a general, and when you get out, you could make seven figures, that tends to pull out that character flaw. And we can spot it now pretty easy. The rank where I see it start happening is about the 06 colonel level in the military. But when Pfizer, for example, has made more money than they ever had on a vaccine that's had more adverse reactions to it than any other vaccine combined, that says something, and the regulations are not being properly upheld as far as safety and et cetera.
Given your insight and experience, what do you think needs to be done to address the issue? And how can ordinary people make a difference?
Okay, so what needs to be done is exactly what we're doing. We got to define the operational environment that we're in, and we are. People like me that are out of uniform can speak more clearly, but there are some of those that are still in. There are whistleblowers like me. I was a whistleblower with Senator Johnson in the Defense Medical Epidemiology Database. So those things we gotta have a few brave souls step up and say, hey, this is what's going on, boss, and you're gonna have to take the hits. You do, but at the local level, that's where especially in Texas, there's some big corporations that run big hospitals. And the corporations don't care about the people of Texas or Oklahoma or any other entity. They don't care about the people. It's the bottom line. The people that run the hospital have to make a choice. And that's where we, as city council people and county commissioners, that's where you can make a difference. And even going to those meetings as a citizen and speaking up, it's a doctrine. It's called the doctrine of lesser magistrates. The lesser magistrates really supersede anything the federal government can do at their local level, but they crack under pressure sometimes, either by grants, by coercion, but just by cowardice sometimes.
On your website, which you have a lot of information, we want to aim some people at that. But you mentioned in the weaponization of public health, the big four. Can you unwrap that a little bit?
Sure. Yeah, the big four. So primarily when I did my homework, I looked at where were the big changes, because there are so many acts now that I suggest, if you're really interested, you want to get into the details, look at Catherine Watt and Sasha Latipova. They did an excellent deep dive into this. But the Turning Point Act, 42 CFR, Code of Federal Regulations, the National Defense Authorization Acts, the last four, where the weaponization really took place under the DOD, is the World Health Organization, and the Treaty Act is taken away. That is really what's under emergency declaration. The president can actually call that, and ultimately, based upon previous codifications of law, ultimately it can result in people going to quarantine camps. That's a most dangerous course of action, but it can happen.
Lastly, what advice would you give to an individual who wants to stay informed and engaged with what you're doing and this issue? Where do they go?
Right. So my website is Dr. Pete Chambers, DRPETE Chambers. There's no dots in there, .com. There's lines of effort there. You can see what we're working on. And it's there for a public to just use it. And then call me, send me a text, an email, and say, hey, doc, I'm finding this out. Because that's how I find things out. It's the people on the ground. They understand what the policies above have done to them. And I want to know that, because I go back and I do lobby to Congress and Senate and talk to them about the National Defense Authorization Act. I'm still involved. I'm on my way to Ohio to speak to the governor, staff in Ohio, to help them with this train derailment, soil remediation. So there's a lot of things happening, and that's where we can interface.
Dr. Pete Chambers, thank you so much for your time. And that's all the time we have to speak with Dr. Chambers. We hope you found this discussion as insightful and informative as we did. Dr. Chambers' observations and insights into the weaponization of public health are critical for us to understand, particularly given the current global health crisis we're facing. By shining a light on this issue, Dr. Chambers has shown us how the intersection of public health and national security can have far-reaching consequences for us all. And as Sam Adams said, it doesn't take a majority to prevail, but rather an irate, tireless minority, keen on setting brush fires of freedom in the minds of men.